We all drive in the white vet truck, the white vet truck, the white vet truck. Hi, this is Dr. Matt Witzel with Western Montana Equine. Thanks for joining me again today in the vet truck. I want to say thank you to Phyllis for asking what the best course of treatment is for Hock arthritis in horses. I just want to say that this is not a fully comprehensive video on everything Hock arthritis related. This is just the basics, what we typically see, and how we typically treat it. So a common misconception is that the hock is composed of just one joint. In reality, it's composed of multiple joints, both high motion and low motion joints. Most of the time we see arthritis forming in the low motion joints, but that can vary to some degree. And osteoarthritis is inflammation in and around the joint. This includes the articular cartilage, the subchondral or the bone underneath the cartilage, and the joint capsule itself. What happens is inflammation in the joint can break down the cartilage, causing long-term damage to it. It can eventually erode all the cartilage to become a bone-on-bone joint, and eventually may even fuse. When we look at joints on radiographs that have arthritis, a lot of times we'll find bone spurs or what we call osteophytes. The clinical signs that we typically associate with Hock arthritis in horses are going to vary depending on the severity of the disease. For instance, a very mild form of osteoarthritis in the hocks may exhibit as the horse having a decrease in performance under certain conditions, whether that be at collection or bringing the horse's hind end underneath itself for a stop. A more moderate case of osteoarthritis may exhibit as refusal or poor behavior under certain circumstances. Again, when you're trying to weight those hocks doing downward transition, the horse might be seen hopping or stumbling. Also, the horse might refuse to pick up a certain lead. Another thing that we might see with moderate arthritis is a behavior change in horses that are actually in pain when they're doing something, and it affects their attitude. In a severe case of Hock arthritis, you may find the horse to be outright limping at the trot. Your veterinarian most likely will diagnose the Hock arthritis in your horse with a lameness exam that's going to include flexions and may or may not include nerve blocks or joint blocks. Once your veterinarian has diagnosed the source of the lameness to the hocks, the next step is going to be take radiographs of those hocks to determine how severe the disease is and if it even is arthritis. It could be unrelated to the joints, it could be a soft tissue injury, or it may be something like an OCD fragment inside the joint capsule. Again, what we're looking for on radiographs to confirm Hock arthritis are going to be those bone spurs that we talked about earlier, or joint space narrowing that would indicate there's a loss of cartilage in those joints. The gold standard treatment for Hock arthritis is injecting those low motion joints, typically with high hyaluronic acid and a steroid. This combination will cool down inflammation in the joint and increase the quality of the fluid or the health of the fluid. A few words of caution about joint injections in horses is that when it comes to steroids, it can induce laminitis in horses that have previous laminitis episodes. If your horse has never had it, the likelihood of it causing is very low, but if your horse has been laminitic in the past, I would recommend staying away from a joint injection that includes a steroid. I would also like to caution against the overuse of steroid injections in horses. Make sure that your horse actually needs the injection before you ask your vet to do the injection. Moving on to the more systemic courses of treatment, these are all treatments that will help with Hock arthritis, but will also help improve joint health in other areas of the body. Addict Juan is a treatment that I've used fairly often in horses with Hock arthritis with pretty decent success actually. It's been shown to reduce the destruction of joints caused by arthritis. It'll repair the damaged cartilage. It decreases inflammation of the joint capsule, which can help to prevent further arthritic changes happening inside the joint. Addict Juan is an injectable administered into the muscle every 4 days for a month. Legend is another medication I've used quite often to treat Hock arthritis. It's hyaluronic acid that you administer in the vein, and it's been shown to produce high quality hyaluronic acid inside the joints for up to 45 days. Because of this, we typically treat at least every 30 days just to stay in that safety window. Legend is another product that will lower the inflammation that can occur in the joint temporarily and thereby help to prevent further arthritic changes from occurring. Most of you all are familiar with a product called Bute or phenylbutazone. This is typically administered orally, comes in powder, paste. Bute is a non-steroidal anti-inflammatory medication that decreases pain and inflammation in joints and otherwhere in the body. You do have to be careful with Bute because overuse can cause some pretty significant stomach ulcers and other problems. Equiox is another non-steroidal anti-inflammatory drug that can be used to treat pain and inflammation in Hock arthritis. Unlike Bute, it's fairly safe for the stomach, typically does not cause any ulceration problems, but you have to give it religiously. It has to be given every single day, otherwise it doesn't work very well. Oral joint supplements are another thing that I would like to cover. Typically, these are going to include glucosamine, chondroitin, MSM, some forms of oral HA. There's a bunch of different brands of joint supplements, and not all of them are equal. I typically recommend sticking with the bigger name brands because those are the guys that have done a lot of research on their products and have probably better quality control. Not to say that there aren't a lot of smaller companies that do an excellent job as well. I would just recommend that you go with something that you've done your research on and that you know is going to help. When it comes to these joint supplements though, I will say that they don't work on every single horse. When they do work, they can make a substantial difference, but they aren't going to work on every single horse. It typically takes 1 to 2 months before you see any type of change. So by all means, try it out on your horse, see if it works, but at least give it a couple months to make sure it's not going to work before you quit it. The last thing that I want to cover is just prevention of Hock arthritis, things that you can do to give your horse a longer career and performance. You've noticed that I've mentioned inflammation quite a bit when I'm talking about these different treatments and medications. Well, because those arthritic changes are secondary to inflammation, if you can prevent inflammation from occurring, you can to some degree prevent arthritis from occurring. When I see a lot of these older horses that have significant arthritis, their bodies have taken a beating because they've been in a performance career for so long. But if you use Legend or Addict Juan or joint supplements to reduce inflammation from occurring in the joint, you can, in theory, prevent some of the arthritis from occurring, thereby giving your horse a more comfortable, longer career in your chosen discipline. Well, that's all I have for Hock arthritis. Thanks for joining Colt and me today in the vet truck. Please like and subscribe to the channel. I'd love to hear from you guys. Let me know what you think of the video. Write down your questions in the comment section. And with that, have a great day. Colt loves horses. Well, that's all I have for Arthur. Yeah. Seriously?